And it's a wonderful district, very diverse, has great food, great culture. But we also have challenges in our schools. And I do want to actually, before I get started, just recognize our great superintendent, Dr. Estrella. And one of those challenges I wanted to discuss with you, and I apologize to everybody that's heard this before, because I've said it a lot in meetings, is about the mental health issues that we face in our district. Unfortunately, in District 4, we have some of the highest negative outcomes in terms of the mental health issues that people are facing. We also have high rates of incarceration, high rates of drug abuse, high rates of physical abuse at home. These are unfortunate things that they happen, and they affect the children that come to our schools on a daily basis. And what we're noticing is that from the data, the proficiency rates are at 3rd grade to 7th grade start to drop versus the city average. And we believe that if we're given mental health counseling in each school in our district, we can start to alleviate some of the issues that these children face when they come in. Because we believe that there's an impediment to learning when these children come from challenging situations. If they're given the opportunity to maybe talk those out, given an opportunity to maybe have some therapeutic session before they start learning, perhaps those outcomes can be changed. And I've been talking to people about how we can address this issue, and it really comes down to funding, unfortunately, which is why I'm very happy to see our state elected officials here. We need your help. And we need you to talk about this in Albany, make it a priority, because what's happening in our district is that schools are closing. You know, they're getting relocated, they're getting closing. And of course with charters, there's a lot of charters in our district, the highest amount probably in the city. So, or close to it. Close to it, sorry about that, close to it. Close to it, yeah, I should say that 5, that's true. But that's just a symptom of the problem. The problem really is I think we want to make sure that these children are prioritized in terms of their ability to learn. I know they're being judged on the proficiency rates, they're being judged on the ELA score and the math score. And it's going to be hard for that to change if they're not able to get the help they need to be the best students they can be. And we really need your help for that, to advocate in Albany, to get that budget too.
So I'm going to do the Albany piece and then Carol, thank you. Carol or Sean, you can speak to what we're doing. So, but one part of this, sometimes money actually is part of the answer. I agree. And I do want to say a thank you to both senators, because even though the budget's not done yet, I know the Senate and the Assembly are really pushing back on the governor's proposal and working to pump up the amount of education funding that will help us immensely. And just one other quick point, that campaign for fiscal equity, as I said, we can never let that idea die. It doesn't, again, we want it to be achieved in the here and now, but even we can't get it all achieved in the here and now, to keep making progress and never let that idea die until the day it is complete. But the good news is these individuals and their colleagues are showing us some real progress as we speak. First Deputy Chancellor, why don't you talk about what we're doing in the here and now with the Deputy Chancellor on the issues facing that district, what we can do to help address some of the mental health challenges.
Yes, and I just want to thank you again, sir, because we have spoken about this before, but thank you for your commitment and your advocacy on this issue. And I would like to introduce my colleague, Deputy Chancellor LaShawn Robinson, to tell you more about what we're doing.
Thank you so much for that question, because mental health for all of our young people is very important. In Manhattan, we have 54 mental health clinics and 135 mental health consultants through Thrive. Very important work. But let me also say that every day in our schools, we work to address mental health from a proactive stance. And that's through social emotional learning, where we work with families and young people to understand self-management, self-awareness, relationship building, pairs with each other, pairs with adults, responsible decision making, because the trick to mental health is to start early or to be proactive so that we're not waiting for an incident to occur. So that young people are learning critical skills so that they can persevere through challenges. And we know in an urban school setting like ours, that I have a 15-year-old in our public schools, our young people have challenges. My own son came home and said, "Mom, I would like counseling." And that's because we're norming mental health for our young people. And I must give credit to Thrive. If you go into our school communities, you'll see posters saying, "There's help all around you. There's help all around you." and we want our young people to know schools are safe, nurturing environments, where we're looking forward to taking care of the whole child, including mental health.
So LaShawn, I want you to take it to the specific level, a little bit more, an excellent overview, but for District 4, if there's a concern about needing more services on mental health, how do you go about assessing that and acting on that?
Absolutely, absolutely. So if you need more specific interventions, if you contact me directly, I'll come out and do a full assessment of your school. I'll look at the resources that you have and ensure that you have the supports that's required for your children in your school community. I didn't hear from you, and I would love to.
All right.